So good evening, everyone. I am Dr. Sandy Arthur, for those who don't know, and this is our first installment for this year of our Checking In on You series. This series involves professionals of the Southwest Regional Health Authority and our friends and social state partners, stakeholders, bringing information to you right into the comfort of your own home. This evening, we will start with a presentation and it will be done by Miss Melissa Brayton. This presentation talks about the access to services within the Southwest Regional Health Authority, more specifically, the primary care services. Why we thought that this is important to bring here is because many times we hear it as healthcare providers when persons say, well, I did not know I could go to my health center for A, or I did not know I could go to my health center for B. So we like to ensure that we share this bit first so that persons can be aware of what they can access in their healthcare centers and how their care can be advanced from that level. So I turn over to Miss Melissa Brayton at this time, who is a Quality Control Officer with the Southwest Regional Health Authority, to bring that presentation for us.
Good afternoon, everyone. You can hear me, right?
Very well.
We're hearing you.
Thank you. Thank you. So my task this afternoon is to present to you all how to access service, which is within the SWRHA, but primarily primary care services at the SWRHA. So just a quick overview of who we are, and we are the Southwest Regional Health Authority, and we are the largest RHA, which serves a population of more than 600,000 persons within the region. At the SWRHA, we comprise of 31 primary healthcare facilities, or as we will call them, health centers, 4 residential care centers, 3 district health facilities, as we would call them, DHFs, and 2 hospitals, which is the San Fernando General and Teaching Hospital, as well as the Point Fortin Hospital. So what is our vision and our mission at the SWRHA to the people of the Southwest region? The vision of the SWRHA is that we would like to become a leading provider of compassionate, cost-effective, premium quality care to the people of the Southwest region. Our mission at the Southwest Regional Health Authority is in the business of promoting wellness, which is something we are doing today, and providing cost-effective, customer-focused healthcare to the people of the Southwest region within the guidelines of the national policy, and ensuring that our staff have a safe and productive and rewarding environment. So what is primary healthcare? So for us, primary healthcare is a whole of society approach to health that aims at ensuring the highest possible level of health and well-being and their equitable distribution by focusing on people's needs as early as possible along the continuum from health promotion, which is who we are, and disease prevention, to treatment, rehabilitation, and palliative care, and as close as feasible to people's everyday environment. And this is a statement that was captured by the WHO and UNICEF, and it's also a statement that is not just a statement, but it's something that the SWRHA lives and walks by. So why is primary healthcare important to you? Just like the statement would have mentioned, it is to help spot health problems before they become serious. It is the best way to manage existing health conditions if you have any health conditions. It's early health intervention. It's the gateway or the gatekeepers to access non-emergent healthcare, and it provides services for every member of your family. So what are some of the services within the SWRHA at the primary healthcare level, or as we will call it, the local health centers? We have health office days. So if you are not a member of a health center, or you are not seeing a general practitioner at this time, you can go, or you can walk into any one of our health centers, which is the health office day. And at the end of this presentation, I would give you a contact number which you can call and get information as to when, the health office days are at a health center that is nearest to you. One of the other services that the health centers offer is what we call the chronic disease clinic. We have antenatal and postnatal clinic, or antenatal and postnatal care. We have child health clinic, which is available at all health centers. We have family planning, which includes pap smears and contraception, for both male and female. Other services at the SWRHA you can get the same day HIV testing, which is at selected health centers, child wellness centers, which is also another feature that is only available at selected health centers. We have dressings. So if you would have had surgery, injuries, or anything like that, cuts, not just bruises, but cuts that require attention, you can go to the health centers and not just get the injury dressed, but they also teach you how you can dress your injuries at home. We have adult immunization. And like I tell people, it's not just for COVID-19 vaccination, but if you check your immunization card and you realize that some of your vaccinations are due, example, tetanus, we also have HPV vaccines available. You can go into any one of your local health centers and be immunized. We have pharmacy services as well at all of our health centers. And it should be noted that the prescriptions that are filled at our pharmacy services, it must be issued at any one of our Southwest service centers. So you cannot take a private prescription and come and get it filled at any one of our pharmacy services. It must be issued within the SWRHA services. We have specialist services as well within the primary care setting or within our local health centers, and those specialist clinics are specialist obstetrics clinic, or as we would call it, SPOG. We have mental health services or mental health clinic, retinopathy screening, smoking cessation clinic, change of catheter, and child development. And these are specialist clinic, and we call it specialist clinic because you have to be referred or be referred by a physician into any one of these clinics. And if you want to know how you can be referred, you can visit, like I mentioned, any one of our local health centers, and they would advise you on how you can be referred or how you can join any one of these specialist clinics. So when do you access service, or how do you access services? You can visit any one of our local health center once or twice a year for appropriate screening and general review, which is something that we need to practice. So it's something that we need to be aware of, that it is something that is normal for you to visit your doctor, even if you're not experiencing any sort of illnesses, just for a general review and just for a checkup and a follow-up on how you are doing, and just to even inquire about things that you can do to avoid any diseases. You should access services for our primary care services at any medical, if you have any medical health issue that does not require a visit to the emergency department. And when should you visit the emergency department? If you are having severe chest pains, severe abdominal pain, if you were in a motor vehicular accident, if you experience a gunshot wound or a chop wound, if you would have had a near drowning experience, or anybody would have had a near drowning experience, if you would have had an allergic reaction, asthma attack, a fall or a blow to your head, or the ingestion of any toxic poison, any toxic substances. These are just some or very few of the items as to why or when you should visit the emergency department. If you visit the Ministry of Health website, you would see a listing as to when as to other issues as to when you can visit the emergency department, and not every issue that you may have requires your visit to the emergency department. Maybe you should just visit your local health center. So how do you access primary healthcare services? You can just walk into any one of our 31 primary care health centers, or as we would say, our health centers, and the days of operations are Monday to Friday from the hours of 8 a.m. to 4 p.m. So you may ask, when is it that my local health center has a walk-in service? And that is where you can utilize our customer service information center, which is our quality customer service line. And you can call them at 87 SWARA, or that's 877-9742. The number is actually a toll-free number. So if you don't have credit on your phone, you can just call the number and you would be able to access the service or access the call. And that is 877-9742. If you don't want to speak with anybody and you would like to just email our customer service center, either for information, to log a complaint, or even to give a commendation, or even after viewing this video about the services or the different types of areas that we would present to you tonight, we advise you to share your comments. We advise you to share your commendations, your feedback, your recommendations, or even share what you would like to see us do in the future. You can do so by emailing our customer service center at customer service, that is CUSTOMERSERVICE at swrha.co.tt, and that is customer service at swrha.co.tt. Or you can also visit any one of our SWARA social media pages. We are on Facebook, Instagram, TikTok. Yes, we are on TikTok, and also YouTube, as Dr. Arthur would have mentioned earlier, that you can go on YouTube and view past videos that we would have done before of our programs, informing members of the public of not just the services, but on different health issues, and even guidelines as to what you should do and when you should do it concerning your health and various topics. So you can visit our YouTube page, and you can also visit our newly launched SWARA website, and that is swrha.co.tt. You can visit our website. That's at the website, you'll be able to get comprehensive information as to the services that are available at all of our hospitals, at all of our health centers. So in case you don't remember exactly all the services, or when or why you should visit our local health centers or primary healthcare centers, you can visit the website, and that will give you a comprehensive information as to all the services that are available at the SWRHA. And once again, like I said, you can always share your feedback with our customer service center. We ask persons to utilize that customer service center for information, even about any one of your primary healthcare centers. You can call the customer service line and they will be able to give you information, not just on the services, but on different things that are happening within the SWRHA at this time that you may not be able to always be aware of, but you can call the customer service line and they will be able to give you information on all our services and everything that is happening within the SWRHA. And once again, that number is 877-9742. That is 87 SWARA, 877-9742. And like I said, you can visit all our social media pages to keep abreast and updated on all that is happening at the SWRHA. So that brings me actually to the end of my presentation on how to access services at the SWRHA, which is primarily primary care services. And I now hand you back over to Dr. Arthur, who is going to guide the rest of the presentation for the afternoon.
Thank you very much, Ms. Brayton, for that comprehensive overview on how to access services within the SWRHA, more specifically the primary care services. And that brings us now to the meat of the matter this evening. We're here this evening to discuss wellness, but we're putting a little spin on it given that we're in the carnival season. So we wanted to ensure that we touched on all aspects of activities that can impact on your health and well-being during this season, things that you might not automatically think about at some points in time. To help us this evening, we have a well-rounded panel, all very qualified at what they do, and I'm going to introduce them to you now. So we have Miss Marcia Tinto, Marcia Tinto, sorry, tongue twister. So she is a Senior Environmental Education Officer at the Environmental Management Authority. Most of us will know that as EMA, and has been an environmental educator for over 27 years. She holds a Master of Science in Education for Sustainability, has been awarded several postgraduate certifications in areas pertaining to her field, and is certified by the U.S. Environmental Protection Agency and WHO, which is World Health Organization. She has been involved in climate change initiatives since 2001. So if we do the math, that's about 22 years, and is currently the national focal point for action for climate empowerment under the United Nations Framework Convention on Climate Change. I give you Ms. Marcia Tinto. Our next panel member is Ms. Abbegail Charran. She is a Public Health Inspector 1 at the County Medical Officer of Health Department for County Victoria, and has had 15 years of experience in her field. Her primary responsibilities include investigating public health matters, processing of building plans and layouts, and food safety monitoring and education. She is passionate about all aspects of health in relation to individuals and the environment. She is also a member of the County Victoria Surveillance Team, assisting with the monitoring of COVID-19 and other infectious diseases. And I know they have had a task over the past 2.5 to 3 years with monitoring, especially COVID-19. Her qualifications include an associate degree in environmental health, a BSc in human nutrition and dietetics, as well as postgraduate diploma in agri-food safety and quality assurance. Ladies and gentlemen, Ms. Abbegail Charran. We also have with us Dr. Makesh Banda, and he is the holder of an MBBS degree in India. He completed postgraduate diploma training in family medicine, as well as HIV management through the European AIDS Clinical Society. He is a registrar for the Queen's Park Counseling Center and Clinic. A lot of us know it as QPCC&C, and is also a pro bono lecturer at the University of the West Indies. Dr. Banda, he's with us this evening. And we also have with us Mr. Errol Fabien, and he is a native of Point Fortin, and he smiles, a cultural buff, founder of Gael the Caribbean, and many other hats. When I asked for an introduction for him today, he gave me his name. So I asked the little birdie for some more information. So Mr. Errol Fabien is with us this evening, and we thank all of our panel members for being here. So we're going to get into our discussion this afternoon, and our speakers are just reminded to unmute themselves when they are going to speak, and then mute back afterwards. So carnival. When we think of carnival, we think of loud music, we think of persons having fun, we think of crowded situations, we think of persons eating a lot on the streets. Unfortunately, I guess we in healthcare might say that, and unfortunately for some persons, they imbibe and they drink a lot more alcohol than they normally would. So I'm going to start with Ms. Tinto. Noise pollution. I don't know if this is something that we often pay attention to, but I know you will tell us a bit about that today.
Okay, good afternoon, everyone. Thank you for having me here. I'm quite pleased to be part of this discussion. Noise pollution. So under the Environmental Management Act, we have the noise pollution control rules. Now, what normally happens, because everyone says call the EMA when people are making noise. Now, this is carnival season and there are lots of parties, fetes. Under the noise pollution control rules, we treat with amplified sound, so sound coming from speakers. So if someone has to have a party, they ought to apply 35 days in advance. 35 days in advance, okay? And they then have to put out a notice in the newspapers so that people will be aware, so the event, the venue, that sort of thing, the hours and so. If we have objection from the community in which the event is being held, we will have some sort of mediation. What they will then be given is a noise variation. That doesn't mean that you are given permission to make noise. So under the noise pollution control rules, from 8 a.m. to 8 p.m., the noise level, which is measured in decibel levels, is usually 85, and then, or 80. And then from 8 p.m. to 8 a.m., it's 65. So obviously at night people have to sleep, so that is considered, and that's for general areas. We also have specific prescribed levels for industrial areas as well as sensitive areas. But we're normally dealing right now with general areas because that's where people have parties. So this variation will tell you how much above the permitted level you can go, particularly after 8 p.m. No variation is the same. So when people say, okay, well, so-and-so had a variation and they were able to go up to 70 and or 75, and the other one, it has a lot to do with the location, with the location most of all, and with respect to whatever kind of objection and so on. So it is determined based on case by case. And it's the process is very transparent. So we don't look at, tribe, sorry, I don't want to call names, but they're having a fete, so they're gonna make noise. No, it's not like that. It's not subjective at all. Now, this variation is not approval to go above the level. What you need to do as the event promoter, and actually it's the venue that is held accountable, not the event promoter, but they need to then bring someone on board to measure the sound level when they're testing the music and ensure that if it says 75, they don't go above that. What happens now is we have our environmental police units, which is a core group of police who have been assigned to the EMA, and they monitor these events, these fetes. Now, they can't go to every fete because you'll have a fete in Point Fortin, you'll have one on the North Coast. So they try to, as much as possible, monitor using the sound level meter, and to ensure that the fete promoter or the event promoter is staying within the prescribed levels as indicated in the variation. We have people, for example, who will call the police. Now, the police have jurisdiction under all legislation in the country, all laws of Trinidad and Tobago. They have the ability to enforce. A lot of people say, and they complain constantly, that we will call, and the police will say, call the EMA, but they actually can do something about it, but then I always say it's about changing mindset. Now, one of the things I must mention here, apart from the facts, we're looking at carnival days, so those are exempt because mobile sources, because one of the things people ask will be mobile sources. So those cars that pass and set off everybody's alarm, under the noise pollution control rules, that does not fall because it's not a stationary source, it's moving. So we can't monitor. Even if it's a big truck that's parked up for 3 hours, it's considered a mobile source. However, there are other pieces of legislation like the Summary Offences Act, other things that the police can use to treat with that sort of noise. We try to encourage people when it comes to noise to it's voluntary compliance, to tell people, look, you have young children, the elderly, animals, we all know the story. And right now we have some ads running which would talk about love the music. That's the slogan, love the music, lose the noise. Love the music, lose the noise. So it's about carnival, yes, but it will continue. Because apart from that, you have a lot of private effects. People in their homes, they gather to lime. They don't think it's an event, and the music's cranked up, the neighbors are complaining. So it's a lot that goes on during carnival, which is sometimes outside of the remit of the EME. As I said,
okay.
So that's noise. So I guess later on we'll talk about a couple other things.
Yes, we will. And some persons might wonder why we talk about noise pollution here. But the thing is that listening to loud noises over prolonged periods of time can cause long-term damage to your ears, which lead to deafness. So knowing about, being able to be in a space in a safe way, and even monitoring and going through the correct channel so you can be given the appropriate advice is important, because we don't want to have a whole set of deaf people walking around before their time. So thank you so much, because I myself did not know that it was such a process in terms of getting these variances and so on. So thank you for that one. Sticking on that part of environmental stuff, I'm going to go to Miss Charran now, and I want her to talk a bit about another process, because during carnival we have a lot of persons buying food from multiple vendors, and I know sometimes that could be a challenge for some, both on the vendor aspect of things as well as the person who is now going to purchase this food.
Hi, good night, everyone, and thank you for having me on this panel. It's an honor to be here. So with the carnival and facts and now all inclusive is, that's the thing now. So we have a lot of food, a lot of street food, everywhere. Just last week, I passed Daybreak Penal for the first time in a really long time, and I noticed like a whole set of food places opened up like for this period here that I didn't even know existed in a long time. But with the carnival coming up, it's important that food handlers are registered, and the definition of food handlers goes along with the definition of what food is. And under the Public Health Ordinance, Chapter 12, number 14, it's food is any solid or liquid that is cooked or uncooked that is offered for sale to be consumed. So once someone is going to eat it and you are receiving money for that, once it's for sale, you need to be registered in order to handle that food and to sell that food. The registration process in Trinidad is by means of what we call the food badge. And now the food badge has an expiry date. So a lot of persons are of the opinion that it's kind of like how your license work, where it expires on the date right before you had renewed your license. But that's not how the food badge works. How the food badge works, it's every calendar year it expires. So if you got a food badge, let's say last year, ending up of last year, October, November, then it's expired at the end of December, and now you have to renew your food badge. So persons who are entering into the carnival period here and wanting to sell food, they need to visit their local health authority to renew their food badges for this period. So the registration process usually takes place between January to March 31st. If you are selling food outside of that period, you could be charged. So we give the grace period of January to March 31st in order for you to register and get your food badge. Now, to get your food badge, it's via the local health authorities, which are your municipal corporations and your city corporations. So we have San Fernando City, we also have Chaguanas Borough, then we have Arima Borough, we have Port of Spain, and then we have all the other municipal corporations. And the process is that you must have a food handler's medical filled out for each person that's applying, and that must be filled out by a registered medical practitioner. So you get that, 2 passport size pictures, and there's a fee attached to it. In most corporations, the fee is $50, and then you take those things into apply, and you are also required to attend a food handlers lecture. So when you go to visit, they will schedule you for a lecture, which will be done by public health staff, public health inspectors, and there we will teach you basic food handling practices, food safety, so that you are equipped to go out and handle food so that you can serve a safer product to consumers. And that is it for registration of food handlers. And it's important that you register so that members of the public would know that hey, I have been through the process, I am registered, I have done food action. It will be a way to show that you can purchase food from me. I know what I'm doing. Right? So that's the process for food handlers and food handling registrations.
Thank you. And again, as she said at the ending there, when you see someone display their food handler's badge, you know at least, or that badge says that that person would have had a basic medical done, they would have had their food handling lecture, and then they would have fulfilled the process to receive that food handler's badge. So when you go to bio, if you see a stall where, for example, they are not wearing the appropriate gear for cooking or even handling food, especially food and so on, so there's no hairnet, there is no gloves or a place to wash hands, then you may have to think twice. Or you see persons having food in inappropriate containers, or warm food is not being kept warm, or cold food is not being kept chill, then think twice, because food poisoning and foodborne illnesses are a real thing. And we oftentimes see persons coming in with vomiting. This is at our clinical level now. Vomiting, diarrhea, and if not handled well, sometimes by some of these persons, especially young children and the elderly, who are more susceptible to dehydration, or even persons who have chronic illnesses like diabetes and so on, it could sometimes result in them having to be admitted to hospital. So you want to ensure that while you're out there having fun, that you also ensure that it's going to be safe fun, so that you don't become unwell afterwards. So everything we're doing here this evening is to ensure you understand how it can impact on your health and how you can avoid some of these pitfalls as you go through your time. So getting a little bit more into clinical things now, because we heard a bit about some of the processes and checks and balances we have. I'm going to go on to Dr. Banda now, and in his role as a registrar for the QPCC&C clinics, what are your greatest concerns around this time for persons?
Hi, good evening, everybody. I'm Dr. Banda here. Well, it's a pleasant evening to discuss such a nice topic, because Carnival is right at the corner right now. So I'm Dr. Banda from QPCC, as I just mentioned. We do lots of things for the people who are before and after during the Carnival situations. When there is a large public gathering, people are more prone to have infections. And one among them, Carnival is nothing but a large crowd gathering in different formats. And people are under the influence of alcohol and some other drugs as well. So when people are having these kind of influences, they could be more prone to have crossing the limit in their line in contact with the other persons. So that leads to more sexual contact, and that could be with a new person, and that could lead to some infections. We see lots of new cases after Carnival. This is we have been seeing this is a trend which goes on whenever there is a large gathering like so. We see that every year STDs will be more prominent in next 2 weeks after the Carnival. So it is always what I recommend people is be under control under these influences, especially alcohol or any other drugs, if they are on any other substance which they are using, because that could lead not only this just into the STIs, but also into crime and violence and traffic accidents. All these things are prone. So after those things, we say know the status. To know the status of a person is very important, because it is good for themselves. It is good for prevention for the other person as well. So there are lots of infections which could come, which could contact for the first time itself, gonorrhea, chlamydia, and even syphilis as well. And one of the very dangerous disease HIV. We see all these kinds of cases, positive cases just after the carnival as well. So what we recommend people is we educate them. We educate them getting tested them and their partners, and also we tell them to use protection. Once when they are going outside, it's always good to have protection with a new person when you are coming in contact. And just to be informed in the sense educate yourself about what symptoms it could be, what kind of transmission it can happen, and what kind of treatments are available. So they should be very much informed about it. And also talk to your partner, whoever it is, whether it's a new partner, male, female, doesn't matter. So we have to be informed to talk to your partner about the situation, what is going on, what was the situation in the past, and what you want to do after that, in case once when you are tested with anything positive, I mean. So what are the best ways to avoid is abstinence. There is nothing better than that. So abstinence is the best way. And in case if that is not possible, we tell them to use protection. Protection is one of the most important thing. And also we also tell such people don't come under the influence of any kind of drugs, as I just mentioned, and vaccinations, whenever if you are not vaccinated with HPV or hepatitis B, and so we tell them to be vaccinated as well. So that is the other thing. And monogamy, limiting to one partner would be always safe in all aspects, not just carnival, and for every time and any time, that would be the best bet what we can recommend them. So apart from these things, as QPCC, what do we provide apart from education is, once when patient comes to us, we investigate in all formats, in the sense we take smear tests, we do blood tests, and we give the results right away, for chlamydia, gonorrhea, trichomonas, yeast infections, bacterial vaginosis, like this we give, and HIV, all these things we get instantaneous results. And we also test them for herpes, we tell them in case if it is needed or not, though it is a spotter kind of case, we still do that. And also we do tests for syphilis and all these things. And once when it is confirmed, and so we treat them right away. We have all kinds of treatments. We have 5 satellite centers in Southwest alone. Apart from QPCC South, which is a main headquarters in San Fernando Hospital, along with that, in the South, we have 5 different centers. One is Rio Claro, Princestown, Cuba, and Siparia, and also in Point 14. So we tell patients, get tested yourself, get treated yourself, we are available in all these centers. And we do testing in all these centers, like HIV and syphilis and all these things. So apart from that, treatment is also readily available, and we recommend them to inform the partner notification. Sometimes they don't want to talk to the partner. We have contact tracers in our department. We take the information from the patient, and we try to contact their partner, saying about the status of the patient, that they need further testing, and in case if it is needed, treatment is also a must. So apart from these things, we also make a proper follow-up on these patients. In case if we miss them, we try to contact them again and bring them back to the system, and we treat them. We treat them in a very good way, so that they should never feel that there is any kind of stigma associated when they come to our clinics. We are very friendly clinic, and we are readily available, and we have a pharmacy right beside within our same clinic, so the patient don't have to go to any other main centers in the pharmacy. We have everything included in our health center, in our clinics. So this is all I can say about our QPCC, and thank you very much. And any further question, I'm right here though.
Thank you, Dr. Banda. I want to come back to ask you about something you mentioned, but at this time, I just want to bring Mr. Fabien into the conversation, because you mentioned something else. You mentioned about overindulgence in certain things, for example, alcohol, drugs, and so on. And I think Mr. Fabien can enlighten us on that a bit more.
Well, Carnival is a time that people feel emboldened to have more substances, more altering substances. Yeah, sorry. And so I understand what the doctor was saying very much, because people coming into emergency, the SWR, all of the RHAs and so on, chances are they would be more likely or not under the influence of some kind of mood or mind-altering substance. So, but it's two different types of engagements out there, so to speak, because people who are in recovery, who are living with substance abuse, really try their best to avoid the carnival celebrations. And people who are active, they find themselves really having themselves a frolicking time at carnival. I know, because I used to be one of those people. And today my work, however, takes me into carnival quite a lot. But today I try to hold on to the tools that I have to keep myself safe from it. But carnival is a time of abandon. Even people who are not using mood and mind altering substances still abandon themselves a little more than they normally would at carnival time because of the nature of the celebration, the nature of the festival.
Good, I understand that. But you mentioned that you use some tools to help you at a time like this. Would you like to share a couple of those tools?
Yeah, well, in our recovery program, we have a 12-step program. Basically, that's a very important and common treatment in all rehab centers and so on. We use a 12-step program. Even people who go to the anonymous meetings is the same 12-step program. And one of the things that is foremost is to avoid slippery places, people, and things. So sometimes a person could go into a band, although it's Carnival Day, with a little network around them and be safe, because without support, a place could be slippery. And the same place, if you have a support network around you, it may not be a slippery place. So we all have to know what situations are slippery for us and to understand where it's okay for us to be and where it's not okay for us to be. The other thing that we hold fast to is that one is too many and 1,000 is never enough. So, which is to help us stay away from that first one. Because if we have one, you could bring 1,000, it's not going to be enough. So those are two of our watchwords that we try to adhere to, especially going into situations like Carnival, because we really need to not be in slippery places. We really need to avoid slippery people and avoid slippery things. And we absolutely do not need to take one drink or one smoke or one tablet.
Thank you for sharing, and for sharing from a personal background as well. That's not oftentimes an easy thing for persons to do. So I'm coming back to you, Dr. Banda, because you mentioned something. You mentioned two things, well, maybe more than that, but I wanted to bring up the HPV. You mentioned that vaccine. So can you tell us about that vaccine a bit more, or why we offer it to persons? HPV.
Yeah, HPV is like, we call it as Gardasil vaccine, which is available in our system. I mean, in our health centers and public system, I mean, even in the private. So HPV is human papilloma virus. There are many strains in that, like just like COVID, like has beta, delta, all these kind of things. HPV has more than 100 strains. Among them, 16 and 18 are more prevalent. These prevalent things are because they cause more damage to our body. They cause cervical cancers, and genital warts are the most common things. And this is one of the most common STD as well. So we give HPV vaccine, human papilloma virus vaccine, which is Gardasil, starting from the age of 9 to 26 for males and 9 to 40 for females, so that we can prevent genital warts and cervical cancers. This is also given along with people who do the pap smears. When they are going for pap smears, which we usually recommend people every 3 years. And every 5 years, we recommend along with the pap smear, we attempt to do the HPV testing as well. So once when you have this vaccine, the possibility for that testing is kind of minimal. We don't need that unless until there is a strong family history of cervical cancers. So these are the ways where we can test and give it. And the way how it is given is, it is an intramuscular injection, one dose, which is called a start dose, and second one is 2 months, and the third one is at 6 months. So 2 booster doses and an initial dose. So 0, 2, and 6. So this is for boys and girls, and for age of 9 and until 26 and 40 for females. And there are no side effects with these things so far. We might have given thousands of cases. People are taking it per year many times. We have seen COVID situation where people are complaining this, that, and everything. People say they have died with COVID vaccines, but this is completely safe vaccine. People can take it, and it will prevent cervical cancer. So I highly recommend people to take their vaccines.
Thanks, Doc. And I'm glad what you said, that it can help to prevent cervical cancers. I think cancer is always a scary topic to broach for many persons, and if we have something that can help decrease our risk of acquiring it, and then I am all for that as well. I've taken my HPV vaccines. I didn't have any problems, and it's been in Trinidad and Tobago for at least 10 to 11 years, because it would have first come here in 2012, and it would have started in other places in the world in 2006. So HPV vaccines, thanks for bringing that up. The other thing you mentioned was infectious diseases, and this is where I'm going to go back to Ms. Charran, because in her role as a surveillance team member for County Victoria, I would like her to share a bit more on infectious diseases and some of the precautions around this time.
Thank you very much. So I'll start off back with food safety and into infectious diseases. Now, Dr. Atta, you would have mentioned some points on food safety. When we look at, for someone with a food badge, we want to look at certain things. So as a patron, when you're out there and you're having a good time, and you may sometimes think that I'm eating and nothing's going to happen to me, but then we have a lot of foodborne illnesses in and around, so we want to prevent that from happening. So as a patron, when you go, observe, make sure that the person has a food badge on display. You look at the cleanliness of the area, ensure that they have wash hand facilities, right? You look at how they are groomed, ensure that they have proper storage for their foods. And one of the things that I like to tell people is, at carnival time, everyone into fitness, you want to stay fit, you want to look good on the road, so eating a lot of salads, eating a lot of raw foods, but these foods are actually higher in the bacteria count, because cooking is a way of sanitizing food, right? Cooking is a way to make food sterile. So when you're out there, I always advise that you try to eat food on the road as hot as possible. So stay away from, I saw some of the pets had like sushi and all of these things there, right? So yes. So there were some pets that had a sushi tent and all of those things. So I would advise that, you try to stay away from anything that's more on, especially with raw fish, any milk-based products, any products that are very perishable that may lead to foodborne illnesses. So try to eat hot foods right away, that you're seeing it cooked in front of you, you're getting it, eat it as fast as possible. And sometimes when you're partying, we're really late. So you may buy something and then after keep it for hours and eat it when you get home, or eat it, so we have to be mindful of this also. Make sure that when you purchase it, that it's being cooked right there and it's not out for a long period of time. So while you're a patron, we want to encourage vendors, we encourage them to practice the 5 keys for safer food. And this was developed by the World Health Organization. And this helps to ensure that we don't have a foodborne illness outbreak. So the first point is keeping clean. You keep yourself clean, your environment clean. Personal hygiene is key. Ensure that you wash your hands. Over the last 2 years, that's one of the things that, honestly, COVID really gave us as a blessing. People started washing their hands more, right? So you ensure that you wash your hands properly and thoroughly, and then you ensure that you sanitize your area. And I know sometimes space might be tight, but don't look to set up a stall right next to the drain that overfull and smelling and all them kind. Try to find an area that is sanitary, that you would have less of a contamination of the food product that you're selling or that you have for sale. Then we have separation of raw and cooked. So when you're out and you're setting up, you don't have a lot of space. So there isn't a lot of space for you to put your items. So we advise that you have different coolers where you can have your raw and cooked separated. You know, you have your hot warmers, then also separate the meat from the non-meat items. So anything that has milk, cheese, eggs, even though those are meat products, they're not meat items because they don't have raw blood. So we want to make sure that when we keep them in coolers, that we keep them separate from each other. Then we look at cooking food thoroughly, and this is quite important. I always say that it's a good thing in Trinidad that we overcook our food compared to, you know, international standards, which is a good thing for us, right? But cook food thoroughly, that ensures that you kill almost all of the dangerous microorganisms, and studies have shown that cooking food to a temperature of 70 degrees Celsius could help to ensure that you have safe consumption of food. And while you cook foods thoroughly, you need to keep the food at safe temperatures. I remember as a child growing up, Swaro had this campaign, Ministry of Health always had this campaign, eat hot foods hot and eat cold foods cold. So it's ensured that you kept food at the temperature that it's supposed to be at. So anything that's chilled, salads, if you have, you know, you're selling burgers and you need to and you're having your lettuce and cucumbers, those things need to be chilled, right? So it can't just be cut up and then a container. It needs to be kept at below 5 degrees Celsius. So ensure you have an ice water bath and that you are topping up the ice. So it's not just cold water, but you do have it in a proper storage where it can maintain the temperature of being below 5 degrees Celsius. And then for hot foods, hot foods are not to be left at room temperature for anything more than 2 hours. So if you know that you don't have a warmer present, that must be out of there with I would usually say within an hour to an hour and a half. But we advise that if you're cooking a big batch and you're not cooking per meal, like if you're doing catering for an event, to ensure that you have your food warmers where you can keep your food at 70 degrees Celsius. So anywhere between 5 and 70 is what we call the danger zone. And you realize that our room temperature, our outdoor temperature falls within that range. So our usual temperature, we would be comfortable 24 to 32, and that falls within the danger zone, and that's where you have rapid multiplication of bacteria. So if the food was contaminated at some part of the process, then there you will have bacteria growing in this food, multiplying, so that when a person buys it, and let's say if the person not eating it right away and taking it at home, by the time they're ready to eat it, they are susceptible to a foodborne illness. So the last point in keeping safe, for 5 keys, sorry, the 5th key for safer food is use safe raw materials. So yes, grocery prices are high, you know, we are looking for deals, but we want to ensure that we are not using products that are beyond its expiry date and best by date. I always tell people that just there's a date for a reason. You know, when you use something beyond that date, yes, let's say certain tin items or a pack of cookies, it may not be spoiled, you wouldn't get ill from it, however, the quality drops every time past that date. So when you use poor quality raw materials, you get a poor quality end product. So we want to ensure that we stay within our dates. We use, if we're using tin items, that is not dented, that is not rusted, not swollen, you know, that the labels are intact, that you're able to identify that that is a safe whole tin before using the product. Right, and these things, when you use fruits and vegetables, ensure that it's not rotting. You know, when you purchase that, it's the packaging not wet. Also, that is important, because if you can see watermarks on the packaging, then you know that that would have been wet at some point and then dried and then sold to you. So you want to inspect the packaging of products when you are purchasing to use in your business. You know, those are key things, because that could give you a bad start point if you use bad raw materials to start with, to cook with. So we encourage vendors to do those things, right? And one of the things that I forgot to mention in the registration is that we do advise FEC promoters that if you know you're having an event, to contact the health department that is within the county that the event is being held. so that inspectors can come in and speak to the vendors, make checks, check the booths out, ensure that we maintain a standard for food safety within the event also. So it's important that you encourage the communication between the Ministry of Health and yourself so we can provide a safe environment all around for your patrons. Then with respect to diseases, we still have COVID-19 and around, we have influenza, we have RSV, so these are all viruses that we are being told about daily. So we still have to be cautious of this and practice all our protocols as the Ministry of Health have been elaborating on for the past 2 years. But also we have other infectious diseases such as foodborne illnesses. And it can be really simple if you're not cleaning. One of the viruses that is a major cause for what we call the stomach bug or gastroenteritis is the noroviruses. And that could just be spread by being in contact with an infected person, or if surfaces are contaminated or food and water contaminated by a virus, then you're able to pick it up and you get vomiting, diarrhea, severe diarrhea sometimes, right? And also then we have other bacteria that can cause diseases such as Salmonella, E. coli, Campylobacter. So we want to ensure that we that we cook food safely, we prepare it, we don't take for granted our health. And when we go through a foodborne illness, something that we try to encourage the public is that if you get vomiting and diarrhea, visit your local health center and let them know that this is happening. I have been to this event and now I am ill, because that way we are now able to respond. Let's say if 3 or more persons, or we see a cluster, 10 or more persons showing up with similar symptoms and they all have something in common. They all went to this party, or they all went, they were all in this area, they all ate here. We're able now to respond and go in full force and ensure that we can help to prevent that from happening again. So it's important. You may say, well, I'm just one person, it's vomiting, it's diarrhea. In 2 days, I might be fine. In 3 days, I will be fine. But those data make a huge impact for us in how we do our job also, to ensure that we can properly monitor what is happening out on the field. So we encourage you to wash your hands, ensure that when you're purchasing, right, before I go, an important point that I want to touch on is ice. So for some reason, ice is something that we think like no bacteria could grow on ice. Like, I don't know, for some reason we think that like we just throw ice in a cooler, and especially if you're going to a cooler fest and you dip your hand in the ice, all the drinks in the ice, using the ice in our drinks, drinking that, right? So it's important to understand that ice is something, it goes in our body, it melts and then it goes in our body. So we need to ensure that when we purchase ice, or if we're making ice, that we use safe water. And one of the things with safe water is that to make water safe, we can bring the water to a rolling boil and let it boil for 5 minutes and then cool it. And then we could use that to make ice, right? And even when it's cool, you can use that water. It's now safe, and you can use that to wash your fruits and vegetables with also. Another way that we can make water safe is by adding chlorine or bleach, Clorox, to water. So you can add a 2 to 3 drops of chlorine to every liter of water, and that will make your water safe. Actually, it's 3 to 5, drops, right? And it will make your water safe. And then you can use that water also to make ice. But if you're purchasing ice, try to have a cooler that has one of the drain offs in it, so that when the water melts, you can drain the water off. Especially if you are a vendor and you have your drinks in coolers, you don't want it to just, you keep sticking your hand in, and so because you don't know, and if you're allowing patrons to take their own drinks also, you don't know if they're washing their hands, who used the toilet, those kind of things. So you don't want them to keep sticking their hands into the cooler, and then somebody else is gonna stick their hand and then take up. A lot of people don't use straws with cans, so they'll just top it up and drink from that. So we want to be safe out there. We want to ensure that we have safe, healthy practices when it comes to food and food hygiene, and those things reduce the infectious diseases. and other gastrointestinal diseases. So thank you so much, Dr. Arthur.
You're welcome. And I am sure that those who are listening realize there's so much more to just going out there to buy a box of food or to buy a drink to drink, especially when you're in these kind of settings. I do hope that you took heed to what was shared about food safety. And you also mentioned something in your discussion when you said, well, you don't want to be close to a bin that's overflowing. And that brings us to another point that I want to refer to Ms. Tinto in terms of littering and waste disposal.
Okay, hi again. Littering, waste disposal. It's something that we have to be mindful of, yes. I think it's, again, I always keep talking about a mindset, because you find that people litter even more with Carnival because you're especially on the road, you just throw whatever there. I remember, it was a number of years ago, we had a Carnival campaign, and the tagline was, if you want to throw waste, throw it in a bin. And we actually we got disposable drums from like the paint factories and so on, and we lined some of the routes of where the bands burst. And many of the drums were taken by vendors who were selling drinks. So they were ideal storage for them. And, we tried it a few years and it was the same thing that happened. So getting back to Ms. Charran in terms of public health, I mean, we constantly work with public health inspectors, because when we have complaints, very often we may have to refer them. Garbage, I mean, we can't underscore why we shouldn't litter. You have leptospirosis, which there have been some years ago where there was an increased number of cases of leptospirosis in a particular area in Trinidad. And when the investigations were done, it was obvious that you had more litter, more garbage being dumped in that area. So you have diseases which are spread by, garbage, because you have rat infestations, cockroaches, and so on. So that's the disease part. Then we're looking at the landfill, because all the garbage eventually is picked up and thrown into the landfill. Our landfills are, above capacity. And what also happens is, and I'm, climate change is something topical. I mean, that's my forte, but we have to relate to that, because what happens when you have garbage in the landfill, it produces methane, which is a greenhouse gas. So it's not just carbon dioxide, it's also methane. So we're looking at it from that angle as well. So we try to encourage people. We have the iCare program, which you would probably see those bins around, but that's for recyclables. But it's about responsible disposal of waste. A lot of people will then say to me, but I can't find a bin anywhere. So this is something, again, as we say, we put the bins out how many years, and people take them to use as other receptors for different things. Very often we blame the city corporation or the municipal corporation for not having bins, but people remove them. And I am not quite sure if I could tell the population, okay, when you are masquerading, ensure that you find a bin to put your waste disposal, whatever in, because there may not be one in sight. But we can say, however, and I think some of the bands are doing it now. I have been out of Carnival for a number of years, so I'm not sure, but the all-inclusive bands may be supplying reusable water bottles or drinks. So I know people would use those as opposed to having, but then you have a lot of people too who are, I call it the water culture, where you use water. I'm not at all, this is no indictment against anybody who sells bottled water. But in terms of actually disposing those items, those bottles, again, it's something that has to be addressed, because later on, because the effects always happen after the merriment, after the celebrations, as Dr. Banda talked about, you know, the people who come to the clinic. You also, I'm sure, would have people having GI diseases because as a result of not even thinking. I know, for example, many people who have had leptospirosis from having eaten at a particular, what should I say, secure restaurant, or from, you know, other sources, and not realizing that how, you know, how did I get this? So it's again tracing that back to litter and how we dispose of it. And as I said, it's a work in progress. It's not that we can say next year Carnival we're going to be, you know, fine, we won't have litter strewn on the streets on Ash Wednesday morning and all the other things that accompany. But I think it's something in terms of responsibility, that people need to take responsibility for what they do, because it is going to impact them and their family and friends eventually if it is that, you know, there's indiscriminate disposal.
Thank you. Thank you for also highlighting how care of the environment can either determine whether or not you remain well or you become unwell. I think oftentimes a lot of persons miss that relationship between our environment and our health and well-being. Dr. Banda, I'm coming back at you because we know that not everyone is going to be in this carnival season well, meaning they don't have any illnesses. So what advice would you give to persons who are living with an illness or a condition during this time? What would you advise them? I think his screen is stuck. So he's maybe having some challenges. Dr. Banda, are you there? All right, we will come back to him. Okay, good. Dr. Banda, you're hearing me?
Sandy, I wanted to add something, you know.
Sure, I was actually coming back to you. We haven't forgotten about you at all. So
No, I didn't forget you. But I'm on the road now, so forgive me. Somebody's holding the phone for me.
No problem.
You know, I spoke earlier on about people who are living with the illness of addiction. And either in recovery or active use. But we have a real big responsibility on the shoulders of the other people, you know, because it is use that leads to abuse. And there's a lot of use at carnival time. So people who may not think they have a problem, or people who probably really don't have a problem, excess use, which leads to abuse, leads to the illness that we want to caution people to really be careful of. And therefore it means that, you know, sometimes you're not the person who is overindulgent, but the person who is overindulgent is driving the car that is taking you home or taking you to the event. And so you put yourself and other road users at risk if we're not able to talk to our friends and to let them know that they have to, that there's a maximum, that there's a point beyond which we would not want you to use, you know. The Alcohol Alliance of Trinidad and Tobago, they had come up with a campaign about having a designated driver. And while that sounds great, it means that the other 4 people in the car can overdo because we have a designated driver. And the fallout from overindulgence in alcohol in particular is not just with respect to road use, because domestic violence, domestic accidents, child abuse and different things like that that happen in the home are connected very much to alcohol is present in a lot of these cases. So there's a responsibility on everybody, not just the person who thinks they're living with the illness. There's a responsibility on everybody to ensure that consumption levels don't go beyond what is, I don't know what is normal, but beyond what could obviously be putting life and limb at risk. And it's not just the person who will have an accident or an event because of their overuse or their overindulgence. The people around can end up having problems because of one person's overindulgence. The people on the road, the people at home, you know, it goes on and on and on. So we just really all have to try to become, and you know, that's beyond the carnival too, a society where it's okay for us to say to somebody, I think you've had enough, and to remove the substance from that person in the interest of everybody else.
I like what you just said, you know, to have someone there to almost like your check and balance to say, well, you know, now enough is enough. It's time to stop. And I oftentimes find that persons don't have that support system around them. And you've actually answered the question that I wanted to ask you next in terms of what kind of advice you would give the persons to avoid certain pitfalls in this time, especially when they know that they are going to indulge in certain substances and so on. Because you had mentioned how you would deal with it from your end as someone who would have been there and are recovering and going through that process. But for those who are not on that road, what advice? So thank you so much for answering that. And I think the key word there is to be each other's checks and balances. Know when enough is enough, not to overstep. And you know, sometimes we think about, you know, have a designated driver. We think that sounds so nice, but as you put it, we're actually giving persons or telling them, well, it's okay for you to overindulge, which is not really the message that
I don't know if you guys are still here. The screen just right. There you are. So it's yes. John. No, yes, drink too much. We go in. Take your time, John. The most we're going to allow you to have today is X amount, right? And then you have to get into a sober zone. You have to, you know, because they have some sober zones on the road too, and you need to spend that amount of time. Else we're not liming with you. Go by yourself. You know, we have to make some contracts, some expectations, make them known to everybody, you know. And the thing is, we will go along with you, John. If your maximum is 4, we're gonna stick to 4 also. That kind of thing to really help the people who need the help and to save all of us from possible fallout.
Okay, thank you so much for that. Dr. Banda, I'm not sure if you're hearing us. If you are, you can, I see you've unmuted yourself. But what I was trying to find out from you as well is what advice would you give to persons who are living with some form of chronic illness at this time as they are indulging or participating in the celebrations of Carnival?
A very good question, Doc. Sorry about my internet. That was, you know, you always have some tech issues like this. Yeah, the question is great. Actually, like, you know, Trinidad has a big population in 2 different formats. One is high blood pressure and the other one is diabetes. So you take any one among them. Let us start with diabetes. People, like, you know, if they are on any kind of like anti-hyperglycemics, like tablets or insulin whatsoever, if they drink a lot of alcohol, that will make them like real dehydrated and the sugars won't be easily available for them, for the body. So abusing of alcohol will make them like, you know, hypoglycemic shocks as well. And these people may fall down and hit on their head or knee or here and there and break their bones, or any kind of traumatic injuries can happen. So people who have this chronic disease, especially diabetes and so, make sure you don't get abused to these things, and make sure, like, you know, you check your sugars, like, you know, all the time, like during morning and evening, especially during these 2 days, which is very vital to control your sugars, because we don't want that one to be RE in any kind of situation wherever you are in. So, and the next thing is, like, you know, you should make sure you have to be accessible to the any kind of medical facility whichever is available, at least a health center or, like, you know, first aid kits and like, you know, a hospital or wherever. Just know your area. As we are from Southwest, so once when you are in the South, like, we have toll-free numbers as said by one of other members on the team. So just access that one. So number 1 thing is access to have your first aid kit, like to check your sugar levels and pressure levels. And next thing is, like, you know, accessible to health centers. And third thing is, like, you know, casualty. So those are the three things. And make sure what you are eating is very important, because we don't want your sugars to go high up and down and so. Next thing is high blood pressure. Like high blood pressure is also one of the very important factor, and people who are in these 2 days, like, if the pressure is way high, like, it could lead into strokes. They already, like, usually jumping here and there, drinking alcohol, and they forget themselves, and they forget their medicines. So any kind of small impact, like, I mean, these 2 days, any kind of impact when the pressure is like so high, people are prone for a stroke. When they are prone for a stroke, like, sometimes, like, that could be so bad, like, they will repent for their life. So make sure you don't eat some foods which are not so advised, especially salt. And second thing is, make sure you take your tablets on time and check your pressure with your first aid kit. So those are the two important things. Of course, we have many other things, like, people who have high blood, apart from high blood pressure and diabetes, heart disease people. Don't jump here and there too much, because heart needs a proper blood flow. Heart needs a proper rhythm, especially when you are already prone. You have to make sure you should have your GTN, your aspirin and Plavix together. So be accessible to all those things. And, like, once when you get any kind of chest pain, within 15 minutes of your time span, be accessible to the medical facilities. So these are the things. And we have many other chronic diseases like thyroid and so, which we don't need to bother too much. But these three are the main important things. And stroke patients as well. Once when like, if you can walk and so, that is well and good. If you can't walk properly, don't get into the crowd and, like, fall down and, like, get injured yourself. So, or any other person who are physically, like, challenged with any other kind of form disabilities, make sure you should be on the safer side, because the crowd is too big. Nobody cares about anybody over there, because the crowd is big and nobody, it is not intentional. Somebody wants to hurt you, but that happens sometimes. So just be watchful, walk on the, like, sides, so that you can easily escape from that crowdy situations. So these are things which I can advise. Make sure first aid kit is first. Second thing is facility, I mean health center also. Third thing is casualty. So these are the steps.
Okay, thank you very much. So we're going to begin to wrap up, but I want to give each panel member the opportunity to summarize and leave some pearls with us. So I'm going to start with Ms. Tinto. Can you summarize and leave us with a few pearls?
Okay, so summarizing, well, I wanted to talk about air quality as well, but then that is something.
And you can go ahead.
Okay, so we have the air quality index, for example, and it's something that you would see on the news, but you can check, because getting into the medical, not that I have a medical background, but public health is something that encompasses environmental health. If you know, for example, that you have respiratory problems, you ought not to go out there, especially if the UV index is high. So today, for example, last time I checked, it was 21, and between 0 and 50, it's healthy. So far we are doing okay. But then you may have in the air, you'll have PM 2.5, PM 10, which will be particulate matters. Just to give a comparison of measurements, 100, so basically particulate matters would be like dust. So that's measured in micrometers. So 10 micrometers, 2.5 micrometers. A strand of hair would be about, the width of the strand of hair would be about 100 micrometers. So just to give a little perspective of dust, which of course scientifically is particulate matter. So we will have that in the air. And I think, again, as Ms. Charran said, COVID has brought some blessings. I mean, a few, not all, but that people are more mindful of respiratory problems now. So whereas before they may, take, asthma or have asthma, but then you realize that once you're out there, you are at risk if you do have respiratory problems. Some people unfortunately find out that they have respiratory problems when they're out especially when you have large crowds and people are smoking and there is dust, you know, the savannah dust as they call it. So that's something that people need to be mindful of as well. Getting back to the noise, as I said, it's not just for carnival. Yes, it's carnival and the feds and so on are being monitored, but we also try to impress upon people that it's your responsibility. So again, love the music, lose the noise. And with respect to littering, again, it's a public health problem. It's a nuisance. You can't have the public health inspectors in every nook and cranny, and people need to take responsibility during carnival and outside of carnival as well. So I think it's important to have that kind of ongoing conversation, even if we are not in the carnival season. Of course, it's important now, but outside of carnival as well. So I think that is my wrap up, more or less. I'm grateful because I've learned quite a bit from both Ms. Charran and Dr. Banda with respect to some of the other things, and Errol, Fabien, the whole business of being accountable and ensuring that people are accountable. I also wanted to, although just put a little a suggestion to many people with respect to alcohol consumption. Many people think, well, I ate, I had a full meal so I can drink. So once I'm eating, I could drink. And that is really a fallacy, because it does not necessarily mean, because everyone has a different capacity in terms of alcohol, tolerance level. So someone can have one drink and, someone can have 3 drinks, 5 drinks. So it doesn't mean, and there's always this thing about, we like to compete. So people compete with one another. Also, the partner is having 3 drinks and I just have 1. No, I have to outdo him. So again, we have to think responsibly, because at the end, people will end up, in the hospitals and in the health centers with non-communicable diseases as well. That's something to be mindful of. I'm just endorsing what Dr. Banda said, but taking your medication. I'm hypertensive. I've been for many years, and I take my medication. My blood pressure is under control. So again, it's about self-care. It's about responsibility, and not all. For example, we have a lot of people who say, "Oh, you're always taking those tablets. Drink this, have the other." And many people mix the medication with what we call the bush medicine. And then, of course, their problems. Or stop taking all those tablets, have garlic, have this, have that. So I think the information is there. It's not that it's not there. I mean, this is an information session. But at the same time, because you want to say, well, having high blood pressure or having diabetes is almost, I don't want people to think that I have that. So I'm going to convince myself that I don't by not taking my medication, and it will go away. So again, I keep repeating the word mindset, but that is so important in terms of changing the way we do things. So thank you.
We totally agree with you, and thank you as well for emphasizing that this year we're really trying to focus on mindfulness and intentional self-care. So that goes along quite nicely with that. Mr. Fabien, we would like to hear from you. We know you're on the road, and we're thanking you for being with us for as long as you have been. So we'll let you wrap up now.
Yeah, well, I want to say a couple of things. For people, Marcia said 35 days, not 35 hours or 35 minutes in advance to apply for your waiver for your event, for your song, right? Also, Abbegail said that may try and keep the food hot. She didn't mean with pepper. It's not pepper hot, she mean, right? Correct? And also, when Dr. Banda talk about taking your meds, guys, prescribe the drugs. It's not them other kind of tablets that only taken these days to get high. Those are not the tablets you're talking about. But that's just a little fun. And wrapping up, what I really want to urge people to do is to be each other's keeper. We talked earlier on about having a little contract, a little agreement. and you can't have one person who have a 4-drink maximum and you drinking 10 in their presence. It's difficult for them to stick to the 4 if you having 10. And so we should all impose that maximum on ourselves. But during the day, also to let the person who has the illness know that you're doing good. You know, give them some positive reinforcement. You know, you're doing good. Look how much fun you have. Look at the real, you know, just to put it in and drive it in that we don't always need mood and mind altering substances to have a good time. Yeah, that's what I'll have to say in wrapping up.
Great, thank you so much. And Ms. Charran?
Thank you. You know, Marcia just mentioned about how people think that they could eat more, drink more, sorry, when they have a full stomach. Well, another thing people think is that the more that you drink, it will kill all the bacteria probably from food. You know, so that they will say, well, yeah, don't worry, the rum will kill that. But no, it doesn't work like that. So, you know, again, we want to ensure that you go through the process, apply for your food badge, all right? If you're unsure of what to do, you can visit any of the corporations. Also, you can visit any of the CMH offices, and we will guide you along the process, even if you want help with setting up your booth, the layout, if you're going to set up any food businesses, you can always come in and chat with the health inspector for your district, and we will guide you along as to, you know, to ensure that you do things that the food will be safe at the end of the day. We want to produce a safe product. That is the goal. And ensure that as a patron that you pay attention to when you're purchasing food as a vendor, that you try your very best to ensure that you produce a safe product for consumers. And we want to ensure also that if you are ill, if you do get sick, like let's say because COVID is still around, so if you know that you are experiencing flu-like symptoms, if you are experiencing any gastrointestinal symptoms such as vomiting and diarrhea, that you don't go to that fete, right? That you don't go out if you know that you are sick, that you don't go to work the next day if you know that you are sick. And if you know that you went to a fete and then you start, you know, your nose starts tingling and you start to feel, you know, you feel like if you're coming down with something, that you also stay at home, stay isolated, and then if these symptoms do worsen, that you go and get tested for COVID-19, because testing is still available, free testing is still available at the designated SWARA test sites, right? And in the SWARA region, it is the Lengua Health Center and the Pleasantville Health Center, which are during the weekend. Then there are also the hospitals. You can visit the Princestown District Health Facility and San Fernando Hospital also, where you could get tested. So we want to ensure that you are safe out there, right? And that you practice safe food hygiene practices and personal hygiene practices, and you ensure that you keep your family safe, because we don't want you taking anything back to your families also. So thank you all so much for being here. I also learned a lot. I made a lot of notes, jot down some stuff, right, that, you know, each of my esteemed colleagues talk about here, and look forward to being part of more discussions like this in the future. Thank you.
Thank you so much. So she gave the sites for County Victoria. We have 3 counties within the Southwest Regional Health Authority. So in County Caroni South, testing is available during the week at the Freeport Health Center, as well as the Coover District Health Facility. And that also would be available to persons during the weekend, as is a district health facility, and it has an accident and emergency attached to it. In County St. Patrick, the tested sites are the Labre Health Center, the Penal Health Center, Faizabad Health Center, and those ones are available during the week, 8 to 4 p.m. Most of the screening would usually be done in the earlier parts of the day, because they sometimes have a pickup time to get stuff forwarded on to other places. During the weekend, the Superior District Health Facility would also facilitate testing, so that there are several sites across the Southwest Regional Health Authority's catchment area where persons can go and they can be screened. Initially, persons would have been accustomed to getting the test, and then they have to wait days to get a result. But now they get their results within 15-20 minutes because they use the antigen test. So we're going to ask Dr. Banda to share his final words before we close off for the evening.
Yeah, so again, as I told you, like, usually most of the times we do make mistakes under the influence. So make sure, like, don't take excess alcohol. One drink is considered for women and 2 drinks for men. That is the usual limit. That is the National Institute of Alcohol Abuse and Alcoholism. That is the guidelines, what they say. So how much is 1 drink? Basically, 12 ounces of regular beer, which has 5% alcohol, or 5 ounces of wine, which has got 12% alcohol, or 1.5 ounces of 40% alcohol. So that is the limit. That is called as 1 drink. So men can have, like, 3 drinks like that. Women can have 1.5 drink like that with 40% alcohol. So don't go excess. Number 2 thing, make sure you use protection. Make sure, like, you stick to same partner. Make sure, like, abstinence is the best answer for all these things. And in case if you come across any kind of situation which happens, whatever, like, during carnival times, get tested prior and also after, like, and also do follow-up testing, and make sure you are in contact with your partner, because in case if they are get tested positive or something, they will also inform you. So that is the other important thing. And QPCC has 5 satellites in the south and 1 major center, which is in San Fernando. Our satellites are Rio Claro, Siparia, Point 14, Princestown, and Cuba. So we cover in all these areas. And the other important thing is, once when you get diagnosed, don't be stigmatized because of anything. Come over and take the treatment. Like, we have everything at one stop. So it's like, one-stop shop. And as asked by Dr. Arthur about the chronic diseases, I again tell people, everybody, carry your prescribed medications and don't be under the influence again, and eat only what is needed to eat. Get enough hydrated, because it will be like, hot sunny days these days. We are seeing like, hot sun these days. So make sure you drink plenty water, get hydrated, and like, once when your sugars and your pressures are within the control, you should be fine. And the cardiac cases, again, don't be over exaggerated with the situations that could lead you into tough situations. So these are the things which I would like to conclude and say. And thank you very much, everybody, for inviting me to this meeting.
Thank you very much, Doc. So once again, thanks to all of our panel members today for a very insightful and thought-provoking session. I learned stuff as well too, and I'm happy for that. I know this may have been the first time that some of you may have heard of this thing called Checking In on You, a series that is hosted by the Southwest Regional Health Authority. It was started in April 2022, and we usually host 1 session each month to discuss some pertinent health issue or to raise awareness about a medical condition that we think oftentimes the public overlooks, but is still very impactful to them and their loved ones. So we want you to look out on our social media handles. If you have not followed us, start doing that. We're on Facebook, we're on Instagram, and as I said, we do TikTok as well. And we also have our website. All of the flyers for these programs are posted there so that you can share with those that you think may benefit, share far and wide. We're happy for that. Our next session is scheduled to be on the 28th of February, and we are attempting to do a live. So we want to go live, and we're going to be discussing a bit about things that affect women. And that's as much as I can share at this point in time. If you want to find out more, you have to join in on the 28th of February. Look out for the flyer. Like I said, we're trying to do a live program. It's going to be the first one we're going to do live. So pray for us so that we continue to spread this message of health, and not just health, but wellness. We want persons to remain well. So it is not just for persons who have medical conditions, but it's for those persons who are perfectly well and they need to remain well, right? So you invite them and encourage them to come in. So thank you once again for joining in, all of our guests who were there. I would just pause just to find out if anyone had any questions for us before I sign off. I'm not seeing anything in the chat. So I guess it was either that we were as clear as crystal or clear as mud. But either which way, we do hope that you learned something this evening, and we look forward to seeing you again. Be safe, enjoy your time out there, and take care.
Thank you, everyone. Bye-bye, and be safe. All the best.
Bye, everyone.